All right, thanks. I will do my best to stay within the 10 minutes. And I want to thank Debbie for inviting me to be part of this panel, and to all of you for uh, being so hospitable to me joining in on this conference and workshop. It's been very interesting. So I'm going to be starting the session here by briefly introducing the Council on Education, which, as Debbie said, is the accrediting body for veterinary medical education in the United States as well as Canada. I'll talk a little bit about the evolution of COE accreditation standards, and then move into a brief description of the international efforts of the Council over the last couple of decades, really. And then finally touch on efforts of the World Organization for Animal Health. It's known by its acronym in French as the OIE. So although they changed their name to World Organization for Animal Health, they're still known by their initials as OIE. And they have moved into the area of veterinary education as well as an infrastructure to build infrastructure in various countries. So I can do this. Great. So the Council on Education is housed within the American Veterinary Medical Association. It's the National Professional Association for Veterinarians in the U.S. It's been recognized by the USDE since the 1950s, a long time. And over those years, the structure of the council has changed a bit. There is a lot of firewalls up between the association and the accrediting body, so that it is truly an independent accrediting body. It's also recognized by CHIA, the Council on Higher Education Accreditation, and is a member of ASPA, the Association of Specialized and Professional Accreditors. So the purview of the council is on the first professional degree program. So in the United States, that would be the Doctor of Veterinary Medicine, the DVM degree, or from Penn, the VMD degree. In other countries, the equivalent first professional degree. It does not look at postgraduate education or continuing education. And one of the things I do want to talk about is the cooperation that we work with the Canadian Veterinary Medical Association. So as I said, we're recognized by the USDE, and the state boards utilize COE accreditation as a means for identifying people eligible for licensure. The same is true in Canada. So the Canadian schools, there's 5 veterinary schools in Canada, are all accredited by the Council on Education. So it is a very much across the northern part of North America, a continuous set of accreditation standards. The Association of American Veterinary Medical Colleges has begun to get more involved with the accreditation process too. It used to be that the Council on Education members were all appointed by the professional association, except for a couple folks. And now the AAVMC appoints the academic part of the council, the actual decision-making body. I'm not going to go into a lot of detail about the accreditation process. There is a website which has all of that information. But what I do want to start with is just the development of our outcomes assessment standard. Prior to 2002, we didn't have a separate outcomes assessment standard. Outcomes assessment was part of the larger curriculum standard. And there wasn't any direct requirement for a direct link back, feedback kind of loop from outcomes assessment to program improvement. And so the reasons for adding an outcomes assessment were several-fold. One of them was the USDE required it. They wanted accountability for a lot of different reasons. But society was also changing, probably in part because of the increasing tuition, some of that increasing quite quickly and markedly to very high levels. And so parents and students wanted some accountability as well, more accountability, more measurable accountability. And then also, outcomes assessment is a really good way to help educators who particularly who are innovating and trying to do different delivery models to deliver the curriculum and to assess their students on learning both basic sciences and clinical sciences. That can be a really good feedback loop. So in 2000, that was about when the council said, well, let's start looking at what an outcomes assessment standard would be. And they did the usual things. They gathered people together, all the stakeholders, the public, the profession, the academicians, everybody involved. And it took about 2 years to go from adoption to a set of iterative, not adoption, but development to a set of iterative review processes to finally get to a standard that everybody was more or less happy with. And then the next 5 to 6 to 10 years maybe, there's been constant kind of review and revision of how effective that outcomes assessment standard really is. And one of the big things that was added in 2007 was 9 clinical competencies were added to that outcomes assessment. And those kind of tied back into the curriculum too. And so we've been living with outcomes assessment. I think the colleges are all getting much more used to it and actually have some really innovative ways of measuring outcomes, both with the clinical competencies as well as the more of the basic science competencies. And as I said, they tie one into the other. So we also have a curriculum standard. So there are many outcomes assessments that tie back into the curriculum standard. And so One Health is one of the areas so that those competencies do fit into the One Health portfolio. And again, One Health is kind of that intersection of human, animal, and environmental health. It's kind of the big picture, holistic look at health. So one of the clinical competencies added to outcomes assessment is an understanding of health promotion and biosecurity, prevention and control of disease, including zoonoses and principles of food safety. One might argue that that is a One Health kind of foundation. There's others, but that's just an example. And then that competency can be related back to the curriculum standard, which states that the curriculum shall provide, among other things, instruction in the principle of epidemiology, zoonoses, food safety, the interrelationship of animals in the environment, and the contribution of the veterinarian to the overall public and professional healthcare teams. Again, a really holistic view. So while all of this was going on from about 2000 up till really the current time, there's been a lot of other things going on. The AVMA's Council on Education was getting more involved in international education, international accreditation as well, which is interesting because from very early on in the process, since about the 70s, the Council on Education has offered accreditation to international schools, established international schools on a voluntary basis, not to new developing schools. We certainly don't have the resources to that, but using the exact same standards in the same process. So nothing changes. And in fact, the Utrecht University Faculty of Veterinary Medicine has been accredited since 1973 by the AVMA Council on Education. But in the 90s, in the mid to late 90s, more and more international schools came to the council to seek accreditation. And so since really the late 90s, 13 additional schools have been accredited outside of the US and Canada. So, so that was all happening as outcomes assessment was being developed and as our standards were being reviewed. So let me talk a little bit now about the International Accreditors Working Group. I'm going to go really quick here. So again, this started off with, because most of the international schools initially were in the United Kingdom or Australia or New Zealand, we started having meetings with the Royal College of Veterinary Surgeons, the accrediting body for veterinary medicine in the UK, and the Australasian Veterinary Boards Council, the accrediting body in Australia and New Zealand. We also had a couple other evaluation groups come to those meetings, and we met to learn about each other's processes, to see the similarities, to see where the challenges were, to see where the opportunities were. And we met several times. You can see on the slide from the late 90s up until 2007. And in 2007, a recommendation was put forward to form an International Accreditors Working Group. And that working group was really designed to carry on the work of this more informal meeting, but also to develop a way to do joint site visits. So many of these schools, the 14 schools that the AVMA Council on Education accredits, are also accredited by their own national or regional accreditor as well. It's important to note that the International Accreditors Working Group is not a decision-making body. It reports back to the accrediting bodies. So there was a combined site visit at Massey University in March 2007 in which 2 site teams, one from the Council on Education and one from the Australasian Veterinary Boards Council, did the site visit at the same time. It's kind of side by side. It wasn't joint, but it was side by side. And it worked pretty well. And that was a model that the first International Accreditors Working Group looked at and said, can this work as a joint site visit? And so that the very first International Accreditors Working Group meeting in the fall of 2007, they adopted they recommended a protocol for a joint site visit. And they said the first one should occur at Murdoch University in Australia. And that happened. And they followed a protocol and looking at all of the standards and using the standards of the Council on Education, and then adding in what was needed from the Royal Veterinary College and the Royal College of Veterinary Surgeons and the AVBC. So some additional information that the European and Australian rules had some additional information that was needed. But bottom line, it's a single site team, combined site team, with a single self-study developed and a single report of evaluation. And then the decision comes back to the accrediting bodies. I'm not going to have time to really go into the OIE ad hoc group on veterinary education. Suffice it to say that the OIE is interested in the delivery of national veterinary services. So think about what the USDA does here. So really public veterinary medicine, not private clinical practice. And their idea is to build the educational infrastructure to help promote the delivery of national veterinary services. So they have also done some information on looking at day one competencies in a kind of a different manner than other groups have done. So these are just key takeaway points. I'll leave that up there. The ability to work effectively across national and regional borders requires some really good getting to know one another, building trust, building relationships. And day one competencies might vary across regions, but there are some common grounds, and those might be in One Health areas. And so that's kind of the lessons learned, I guess.
Great, thank you very much. That's a wonderful introduction to kind of the baseline for our profession. And now we're going to